Hey everybody, this is Tom Judd. I'm going to speak today on the critical role of clinical engineers during COVID-19 and lessons learned for the international community, and particularly focus on the global CE community's emerging leaders during this time. Leadership comes out when times are hard. I have the privilege of being the IFMBE CED board chair. You can see what I'm going to speak about, a little bit about CED and then our global response through a variety of initiatives beginning in March 2020. But I'm going to give a hint about a story that's coming a little bit later in this session where collaborator Dr. Judd Sharma in India, who represents the WHO Southeast Asia region, will talk about what he's done at AMTZ in response to COVID. It's really amazing, but it's a whole nother talk. And then as a result of what we've seen as the global CE community during these years, what emerging leaders have we seen? And I've got two from each of the WHO regions of the world that I'll highlight. Well, CED, how are we doing? Well, we've really grown in recent years as we've partnered with WHO through COVID times and tried to make a difference with a lot of relevant information to our community around the world. And you can see we now have over 500 collaborators from 196 countries. So a little teaser about the story about Dr. Sharma that's going to come. So what was happening in March 2020? Well, we had grown, we'd had a Congress, CED, but we were working with our regions trying to move ahead, but then all of a sudden the pandemic hit. And Adriana Velasquez of WHO called Dr. Yadin David and myself, two leaders of our community, and said, two immediate needs we have. Can we get these 1,000 ventilators that China wants to donate to the US? Can we validate those? And can we start bringing many experts to help her, as so many things were coming to WHO there in March 2020. And we did immediately start that work, and we actually started also a daily newsletter. But over our colleagues at so this is about the impacts of what we were doing. How did it impact our colleagues, or what were they doing? And we're cousins and we help each other. So AMTZ over in India had begun before the pandemic, but it really stepped up during the pandemic. I note a few of the things they put in place in the earlier time before the pandemic here on the screen. But they put this knowledge institute together. They put a promotion council at the national level together. They started developing their skills of their practitioners, so they were ready. But so what else has CED done? And what CED has done is have created a 5-step knowledge network since March of 2020 with global webinars partnered with WHO around many relevant topics. We've had monthly board and collaborator meetings with a growing number of people. You see, 60 to 70 people, 40 to 50 countries come in regularly. So when Adriana comes and tells what's going on or what the needs are, we've got a lot of people there to listen. The third thing is we've passed on her monthly medical devices newsletter. A lot of late breaking and important information flows through that. Adriana is also, and WHO has also connected CED to WHO's many funding partners like the Every Breath Counts Coalition that includes the World Bank and Clinton and PATH and Partners in Health and Gates and many folks. So we go to weekly meetings around that and are connected. And we're talking with Adriana a lot. Fourth, we've created an expert Q&A and problem-solving team on a WhatsApp group. Now over 200 subscribers from 70 countries, and we answer a lot of COVID issues and a lot of other professional issues on a daily basis. And we try to get, and encourage countries to develop their own and maybe send a representative to this big group. And lastly, as I mentioned quickly before, there was so much information coming in the literature about COVID related to health technology in general and clinical engineering in particular. So we've started in late May and have done every weekday. We've met since then, Monday to Friday, creating this e-newsletter with just I think it's over 4,000 citations now, just a few each day, but it's built up over here over 2.5 years now around all these issues that you see on the page. So that newsletter and our webinars with WHO really focus on things you would expect from the clinical engineering division. on related to devices and systems and digital tools, like what are the clinical requirements, what are the supply of necessary tools, equipment, and resources, training, coordination, making sure decontamination, and systems approach and safety management. So we're proud of that. And we're not done yet. We've got a lot more going on, and people are continuing to work on this together, and together we're making it better. But in this last remaining time, I'm doing well here on time. We want to highlight these folks that have risen and really made a difference in their countries and in their regions during this last critical 2 years of COVID-19. And I'm going to talk about a bit more about Baron Arunyar there in Nepal, Anwar Hossain there in Bangladesh, Ms. Keiko Fukuta in Japan, Li Bin in China, Ms. Tazeen Bukhari in Pakistan, Ms. Hanan Alawadi in Kuwait, Dan Clark in UK, Umberto Naco in Italy, Ms. Francine Mutesi in Rwanda, Ashnafi Hussein in Ethiopia, Evanel Osias in Haiti, and Mrs. actually Rosana Rivas there in Peru. So, you know, time doesn't permit me to tell all the stories about these folks, but let me give you some thumbnails. So Baron in Biomedical Engineering Society in Nepal, you know, was one of those LMIC countries that had to, you know, deal with the pandemic with less resources than maybe other countries like my own. He had 10 years of experience in hospitals and began to work with Ministry of Health in Nepal, and then helped develop his national society since 2020. And there was a lot going on. You see notes about helping with procurement to, you know, get that influx of equipment the country needed. And then Baron's really been working with WHO in the Southeast Asia office in several ways around getting the right tools from trusted locations and getting people ready and putting together, communicating that kind of information on a regular basis. So I want to highlight Baron's work in Nepal. And then now Dr. Anwar Hossain, as you see, he's been serving in Bangladesh for 30 years, but in more recent times, he headed the startup of his national society in the last 5 years. And then in COVID, in the last two and a half years, they've been working with the Ministry of Health. There are a wide number of practitioners, CE practitioners in their country, and they really serve patients in so many different ways. And oh, by the way, Anwar did this while he was completing his PhD in biomedical engineering. Some of the examples of what they've done is getting Ministry of Health approval for CE and BMETs in the hospitals, widely implementing curricula in universities, many training courses, something like 45 of them for CE, BMETs, and nurses, or more than that, and global leadership in providing oxygen resources for healthcare. We've really looked at what Bangladesh has done, and that's a global best practice around oxygen. He's been a consistent advocate for growing in his country, educating people, and contributing to global activities. So that's just one region. How are we doing here on time? Doing well. So Keiko, working with the very large Japanese Association of Clinical Engineering, I think more than 25,000 clinical engineers in that group. So in the early stages of COVID, Keiko was involved in their Ministry of Health, or working for the Ministry of Health, communicating key leaders of our national society about sharing information. And, you know, over those couple of years has really had a lot of national CE related webinars sharing best practices to combat COVID. She also knew, because she was in the Ministry of Health, and was able to share, you know, the coming strategies and so forth to help the other leaders, clinical engineering leaders in our country, respond in the best possible way. And she, Keiko, happened to be a WHO clinical engineering intern earlier on, been at the Ministry of Health now, as you see, and she's a collaborator with us, and also a Global CE Alliance Foundation or council member. My friend, Dr. Li Bin in the China Society of Clinical Engineering. You know, he's got many years, nearly 20 years in the Shanghai hospital system, leading clinical engineering there. He's the head of their National Clinical Engineering Society, which is perhaps 100,000 clinical engineers, been leading a lot of work with and many participants in training programs and innovation programs, as you see there. And he's also been a board member for IFMBE CED and help China be involved globally in so many different ways. And so very thankful for Li Bin's ongoing work. So that was the Western Pacific region. We go on to the Eastern Mediterranean regional area, the Middle East, North Africa. Two incredible women here, Tazeen Bukhari from the Biomedical Engineering Society and Technology Group called BEST. They're in Pakistan. So just in the past couple of years, she's worked, as she says, directly and indirectly through WHO and the USAID and the Ministry of Health, particularly around regulation and around oxygen. So one thing, she did the WHO survey in her country for oxygen and respiratory related resources, which is a cool assignment for any clinical engineer to get. In the regulation area, she says here, they've been working on developing regulations and guidelines, particularly around emergency use authorization for the high priority devices that countries need, but don't often have all the regulatory controls for that. And all of that's being put into policy now and into legislation. And she helped create the National Society and introduce it to CED, and a really key leader that's been part of a steering committee we created for all the countries of Middle East, North Africa. Similarly, Ms. Hanan Awadi for the Kuwait Association for Biomedical Engineers, what she's sharing here, and I share with her, is her National Society has really tried to be a resource to the whole Gulf area and Gulf countries, and and help provide technical consultations for free of charge for public institutions. And you see they've created many sort of teams within her National Society that she's helped lead, including 3D printing of face shields and so forth. And many training webinars. I see my time's running a little late, but I'll keep going. Dan Clark, quite a story in UK. Basically, so many ventilators were needed in that country. So many sources, what was coming in was not well managed. They turned it over to Dan, and he turned it around. And as a result of incredible work with so many different branches of government there in UK and success in getting the right ventilators to the right patients, Dan was given awarded the Order of the British Empire. How cool is that? By the Queen. And in Italy, Umberto Naco was able to lead a society that's a very sort of advanced clinical engineering country, but so they were on the front lines as the waves of the pandemic hit, and he really kept them together, and not only sharing so much information, but helping people stay thriving and viable in the midst of really hard and difficult situations. So just an incredible website, incredible organization, and he led all that in an important way. And lastly, Francine in Rwanda, part of the Rwanda Biomedical Center that's very closely tied to the Ministry of Health, and helping lead that division, and particularly working in the area of oxygen and the gaps in her countries. And then she's also led her national society, and spreading the good words and the best practices that we share across all of her practitioners in her country. And the oxygen response that she's helped lead in Rwanda has gotten the attention of the president there. And so at the government level, with government assistance in the Ministry of Health, they've been able to really increase their oxygen resources and serve a lot of countries in an important way. Certainly last but not least is Ashnafi Hussein, based out of Ethiopia, but he really leads an Africa-wide professional group that has taken on all these respiratory challenges, worked in his own country in important ways with the Ministry of Health, and has once again led many colleagues across many countries in Africa to know what the best practices are and to share them in English and French. So very thankful for his leadership. So, and wow, it just keeps on going. Rosanna in the Americas from Peru, part of the WHO Collaborating Center, working with the Ministry of Health and the National Institute of Health. Once again, many communication channels and many evaluations and a lot of teaching and a lot of facilitating, and a globally known consultant working with in the country and also in the WHO Collaborating Center that focuses on that part of the world. And this is truly our last is Evanel in Haiti, who is with it led some of the, and been a part of some of the training that the Dalton Foundation, the Relink Global Medical NGO has done, as well as really been a model clinical engineer at his own hospital there in northern Haiti, and fighting against the needs for oxygen and doing the best for patients on a daily basis. And so he's been a leader among clinical engineers there in Haiti. So thanks for your time.